to reduce the transmission of the coronavirus, and in this case, the UK variant in our community. By reducing transmission, we protect our loved ones who may be medically vulnerable, ensure our healthcare system doesn't become overwhelmed, and support our dedicated healthcare professionals who work within it. Due to this outbreak, a number of our essential frontline workers have been impacted in various ways. Some have had to quarantine due to them or their family members potentially being exposed to a positive case. Others have been asked to temporarily support other vital operations such as contact tracing and moving from the lab to help with swabbing. If this stress on our limited resources continues and more of our healthcare workers are impacted, we would lose the crucial momentum we have gained in getting persons vaccinated. This is something that as a country, we must not allow to happen. Tonight, as I have been throughout our fight against the coronavirus, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide all of us with an update on the latest COVID-19 test results, vaccination statistics, and other matters from her ministry. Following the minister, I'll provide a reminder of the current COVID-19 regulations, as well as address some of the questions and concerns raised by members of the public directly with my office and via social media over the last few days. We are also joined by the Chief Medical Officer, Dr. Ayo Oyenloye, who can answer any technical or medical questions from the media. First tonight, we will hear from the Minister of Health. Minister.
Good afternoon, everyone. The Ministry of Health received 1,036 test results since the last update, and 21 were positive for COVID-19. 10 of the new cases are classified as local transmission with a known contact, as they are associated with known cases. The additional 11 new cases are classified as under investigation. These cases are among residents with no currently identified link to either known cases or history of travel in the past 14 days. Additionally, since the last update, there were no recoveries. There are currently 417 active cases, of which 414 are under public health monitoring and 3 are in hospital and none in critical care. Since March 2020, Bermuda has recorded 1,157 total confirmed cases of COVID-19. Out of those, 728 persons have recovered and 12 persons have sadly succumbed to COVID-19. The mean age of all confirmed positive cases is 41 years, with the median being 39, and the ages range from less than 1 year to greater than 100 years. The mean age of all currently active cases is 38 years, with the median 37 years, and the ages range from less than 10 years, age groups from 0 to 9 years, to greater than 80 years, and those age groups are from 80 to 100 years. Details will not be provided for those persons that are hospitalized to protect privacy and confidentiality. The mean age of all deceased cases is 75 years, with the median age being 77, and the ages range from less than 60 years, and that age group is 50 to 59, to greater than 80 years, and that age group is 80 to 100 years. The source of all cases is as follows: 241 are imported, 793 are classified as local transmission, of which 701 are local transmission with a known contact or source, and 92 are local transmission with an unknown contact and source, and 123 are under investigation. As investigations proceed, transmission categories may change. Today's update has 30 cases moving from under investigation to local transmission with known contact or source. Of the over 190,000 test results reported, the mean age of all persons tested is 43 years, with the median being 42, and the ages range from less than 1 year to greater than 100 years. The 7-day average of our real-time reproduction number is 2.11. Bermuda's current country status is sporadic cases, and that's as determined by the World Health Organization, and community transmission as determined by the Pan American Health Organization. Sporadic cases means having a few cases which may be imported or locally acquired. However, community transmission signifies outbreaks where it is difficult to relate confirmed cases through chains of transmission for a large number of cases, or there are widely dispersed cases detected in the past 14 days. As I said last Saturday, this outbreak is significant. We have community spread, and every day the numbers are increasing. However, we'll get better, especially if we all do our part and take responsibility for our own individual behaviors. I will now provide an update on the vaccine program. We have now completed the 11th full week of vaccinations, and from the 11th of January to the 27th of March, 2021, Bermuda has administered a total of 37,788 vaccinations, a figure that rises to 38,557 if you include yesterday's vaccinations as well, and all of which is very, very good news. Of the 37,788 vaccinations administered for the period that we are reporting on, which ends the 27th of March, 54% of those persons were women and 46% of those persons were men. Bermuda's goal of herd immunity will be achieved when we reach 70%, which of our population, which is of a population of 64,054, and that 70% have been immunized. To date, 35% of the population has been vaccinated with 1 dose, and 24% of the population has been immunized with 2 doses. 4,290 vaccinations were delivered during the week of March 14th to the 20th, and the public has accessed these vaccinations at the following locations. The Vaccination Center at Bermuda College administered 23,049, or 61% of the vaccinations, and 13,743, or 36%, were administered at the Bermuda Hospitals Board Vaccination Center, with 996, or 3%, were administered at other vaccination sites. Significant progress has been made in vaccinating our population and especially our most vulnerable persons. 63% of all residents over the age of 65 years have had at least 1 vaccination, with 50% being fully immunized. 49% of individuals between the ages of 50 to 64 years of age have received at least 1 vaccination, with 34% being fully immunized. 19% of residents less than 50 years of age have been vaccinated with at least 1 dose, and which is an increase of 6% just this past week. This is encouraging as this group falls within the phase 3, which has just opened up only a week ago. Vaccinations are continuing at a steady pace, and we are seeing both the number vaccinated and the number immunized climbing steadily by 3 to 4% each week. These are excellent results so far, and I would like to again thank all those persons who have stepped forward, acknowledging their responsibility to the community and to their families and their loved ones to get vaccinated to help protect themselves, their families, and our community. I want to remind residents that we are in phase 3 of Bermuda's COVID-19 vaccine allocation strategy. Phase 3 is for residents who are 16 years of age or older. Priority will continue to be given to our more vulnerable populations, including seniors and those who have medical conditions. If you have not already registered, please do so by completing the registration form. The link is on the homepage of government.bm. If you are over 65 years old, walk-ins will begin again on Monday, the 5th of April from 8 a.m. until 9 o'clock a.m. You do not need to register in advance, just show up. Registration numbers continue to rise, with more than 2,500 online registrations received this past week alone. In the week ending March 27th, 24,256 persons have registered their interest in getting vaccinated, and the breakdown is as follows. 7,460 persons were Black, and that represents 31%, or 11,184 persons were white, representing 46%, 3,819 or 16% represented as other or mixed, and 1,793 or 7% preferred not to say or did not specify. Negative test results in order to get your first or your second dose. Also, if you are in quarantine, please do not attend your vaccination appointment. Please let the vaccine program know that you are in quarantine and that you will miss your appointment. The appointment can be rescheduled, and if it is your second appointment, it can be rescheduled for up. Please call the hotline at 444-2498, selecting option 2, or email vaccine@gov.bm. The further ahead we get with vaccinations, the better we are able to respond to this outbreak. However, I must remind everyone that fully immunized persons can still get COVID-19. They will be less ill and have mild symptoms or no symptoms at all, but vaccinated persons are better off than non-vaccinated persons because vaccinated persons will not get severely ill. We are experiencing some delays with contact tracing communications with those who have been in close contact with someone who has tested positive. The number of positive cases over the past few days indicates the volume of calls that need to be made. If each positive case was in contact with only 4 or 5 people, that means each of those people must be contacted and asked to get tested. We know many people who have tested positive have been in contact with quite a few people. In fact, one case we heard of the other day had 81 close contacts. So the contact tracing does take longer in these types of instances. So we ask members of the public to please be patient. If you are contacted by someone who has tested positive and they tell you that they have identified you as a close contact, we ask that you prepare yourselves and quarantine for 14 days. If you are exposed to the virus, a negative test result after exposure means that you do not have an infection at that point in time. Remember, a test is a snapshot in time. It does not change the incubation period, and you may still get an infection up to 14 days later after the exposure. So please protect others by staying away from others and quarantine yourself. Additionally, if you are in isolation or in quarantine, you cannot go out in public and do not get COVID tested until day 14. I want to also remind employers that they do not have access, that they do not have access to their employers' COVID test results. Let me repeat that. Employers, you do not have access to the test results of your quarantine. You are not allowed to travel for 14 days. It is worth noting that international health regulations, or the IHR, clearly state all persons who test positive in Bermuda are subject to 14-day isolation. General testing policy is no additional test during this isolation period. If anyone wishes to leave Bermuda within 14 days of testing positive, the Epidemiology and Surveillance Unit, on behalf of the Chief Medical Officer as Bermuda's regulator, IHR focal point, must communicate this to the IHR focal point for the United Kingdom Overseas Territories, and that's Public Health England, and to the intended destination, for example, the CDC, the Center for Disease Control, if that is in the United States, which is in the United States. These obligations are reciprocal in that Public Health England and CDC will also inform us in Bermuda through the Epidemiology and Surveillance Unit if they are aware of any persons with intended travel into or out of Bermuda who have tested positive within their travel restriction period. Discussions are then had between Bermuda and the country of intended destination regarding any possible clearance for travel. Bermuda is obliged to do this reporting. This is under the Quarantine Act. Before I close, I want to remind everyone that the Ministry of Health has 2 walk-ins and drive-through pop-up locations that will offer COVID-19 testing to the community. You do not need an appointment to get tested at these locations, and the details of these locations are as follows. TCD, which is outdoor drive-through lanes, tomorrow, Wednesday, the 31st of March, from 5:30 to 7:30 p.m., and Horseshoe Bay Beach Car Park, Monday, the 5th of April, and Wednesday, the 7th of April, from 4:30 to 7:30 p.m. Both walk-in and drive-through testing will be offered at TCD, while only walk-in testing will be provided at Horseshoe Bay Beach Car Park. And I encourage persons to get tested and to know their COVID status. I would really like to pause for a moment and publicly thank Edgewood Pediatric Services, who advised us today that they are opening up to everyone to get COVID-19 testing for this entire week. Anyone who wants to visit them for COVID tests can go to Edgewood website and book a test. And their site is edgewoodpediatrics.com. The testing is done by appointment only, and I commend them as good corporate citizens. And I thank in particular Dr. Sylvanus Nawab and his team for providing this much needed service to the community free of charge. Remember, Bermuda, stay in your household bubbles at all times, especially this Easter weekend. If kite flying, Stay within your household bubble. Your household bubble comprises the people that you live with only. If possible, enjoy your kite flying from your own property. If kite flying from a park or recreation area, stay within your household bubble. Again, those are the people that you live with. Do not mix with others at the same park. Do not visit them or invite to visit your aunts, your uncles, or your cousins, or your friends, or etc. Do not mix at all. Even if you are planning a family activity outdoors, I cannot stress enough. No mixing of households. Continue to wear a mask, physically distance from others, and practice good hand hygiene at all times, even if you are immunized. As I said earlier, being immunized does not mean that you cannot get the virus. Be aware of the symptoms which are easily associated with allergies, such as sore throat, tiredness, and headaches, coughing, and sneezing. The virus can be spread even if you are outdoors socializing closer than 6 feet to others. Avoid yard and beach parties and any gatherings of more than 10 people that are not in your immediate household. If you have not already, then I would also invite you to download the We Health app, which is designed to help slow the spread of COVID-19 by anonymously notifying app users of potential exposure to COVID-19. Please follow the Bermuda government guidelines. We are trying to contain the virus while vaccinating our residents at the same time. Again, I would urge all members of the public to remember our plea, which with respect to the mixing of families and social activities outside of your immediate bubble. That is where we are seeing the spread of COVID as quickly as we are in our community. Once we have this virus under control, we can relax the restrictions, but not until we have it under control. So please, everyone, let's do your part to help us to get this under control. Thank you.
Thank you, Minister of Health. And I thank you on behalf of the entire cabinet and the country for your leadership and for steadily guiding us through this pandemic. You and so many others within your ministry have sacrificed time with your families and friends, worked late nights, 7 days a week, and continue to work each and every day to help us get through this outbreak. As we close in on 200,000 tests, it's important for us all to remember that behind these numbers we report every day are Bermudians who are working tirelessly to provide them. From the swabbing, to the lab testing, to those persons working in the Ministry of Health, the epidemiologists, they're all done by devoted and unwavering professionals who have answered the call to serve their country. I must also acknowledge and thank Dr. Greeka Weldon and her outstanding team of young Bermudians at the Molecular Diagnostic Laboratory, who, like the Minister and the Ministry of Health teams, have been on the front lines from the very beginning, as well as all of the teams at the Bermuda College and the King Edward Memorial Hospital vaccination centers, our contact tracers, and certainly those in the community, our nurses and doctors who are helping to make sure that we deal with this outbreak. Each day, but especially during an outbreak, all of these persons work relentlessly to support the government and the people of Bermuda with the important information we need to make informed decisions. Their work is invaluable, and they all deserve our gratitude. Yesterday, the Ministry of Health reported triple-digit positive cases over 2 days, with 61 positives from Sunday's report, a positivity rate of 4.5% on all tests, and 47 positive from Monday's report, with a positivity rate of 3.4%. Today, we add to that a further 21 confirmed cases, with a positivity rate around 2%. These numbers prove the high level of transmissibility of the UK variant and why we have to continue to make sure that we work to curb this outbreak. As I mentioned earlier, the regulations we currently have in place have been implemented to reduce transmission and to prevent our public health system from becoming overwhelmed. The system is not only the hospital, which now sadly has 3 people admitted with coronavirus disease, but also includes teams like that at the Ministry of Health and the Molecular Diagnostic Laboratory. I ask that we all bear them and so many others in mind as we go over these measures again. On Saturday, the Cabinet agreed to the following changes to the COVID-19 regulations. Churches and indoor religious services are congregants, but open to a max of 10 clergy or those persons required to facilitate services for broadcasts. Indoor funerals and viewings of the deceased are permitted with up to 10 mourners plus the officiant and funeral home staff, provided appropriate physical distancing is maintained at all times. Outdoor weddings and funerals can have a maximum of 20 persons with masks and physical distancing. Indoor dining is prohibited except for hotels, whose indoor dining is restricted to hotel guests only. Outdoor restaurants and bars can remain open with a maximum of 6 persons per table, with the regular restrictions in place that masks are only to be removed when you are seated at the table. Indoor gyms are closed, as well as bowling alleys, indoor cinemas, museums, or any other indoor place of public resort. Outdoor facilities such as golf courses. Retail stores are restricted to 20% of approved occupancy at any one time. There is guidance available on the government website of how to calculate this, and the government website again is coronavirus.gov.bm. To minimize the mixing of school-aged children, which represent a significant proportion of our active cases, schools and camps are to be closed. However, licensed registered daycare centers and home providers will be allowed to open following strict public health guidance and will be visited by public health officers. Remote working will now be mandatory where at all possible, and if your job can be done from your home, you should stay home. There will be limited government and court services, and public transport will operate on their full schedule with reduced capacity. Curfew remains in place from 11 p.m. to 5 a.m., and this measure is necessary to deter social gatherings late at night where there is a further possibility of not adhering to regulations. Personal services such as beauty salons and bars can remain open, with service providers required to wear PPE such as masks, gloves, and eye protection, and customers should also wear a mask at all times. These regulations and those announced last week will be reviewed by the Cabinet in 2 weeks' time. Eligible businesses that cannot operate and individuals who cannot work due to these regulations will continue to be supported by the government. Businesses can apply for grants from the Bermuda Economic Development Corporation to assist with overhead and other expenses by going to bedc.bm. Individuals can apply for the unemployment benefit from the Ministry of Finance by going to uba.gov.bm. Ultimately, businesses want to reopen and everyone wants to get back to work. Those are 2 things that I'm certain we can all agree we want to happen as soon as possible. However, in order to make that a reality, we all have a role to play. While these measures are in place, I continue to encourage persons to stay at home. If you're feeling unwell, please get tested and know your status. If you're called by a contact tracer, please cooperate with them and provide them with all the information they need, as well as following any instructions that they give to you. Remember that anything you say to them is completely confidential. So even if you have done something that you should not have done, it is vital that you share that information to protect others and to slow this outbreak. Contact tracers will not give your information to the police, so please cooperate with them, and this outbreak will end more quickly. If you have the We Health Bermuda app on your phone, make sure you are using it. And if you are diagnosed receive a positive diagnosis, please make sure you enter the app that the contact tracer gives you into your phone. This will alert anyone you've been in contact with, and they in turn can get public health advice, contact the contact tracer, and get tested as soon as possible. The We Health app is working, but people must enter the code they receive to anonymously alert your contacts. To assist our contact tracers and to assist in a quicker opening of our economy, please download the We Health app if you have not already done so. Over 21,900 persons, or 34% of the population, have already downloaded it and are actively helping our cause by simply having the app run in the background on their phones. And this includes an additional 500 downloads over the last week. What is important is the reason why we want to use the We Health app, and I can give you certain examples. For individuals who have been using the WeHealth app, who have been in contact with a positive person, the app can detect the contact. And rather than a blanket quarantine of 50 people, there is minimal amount of people that have to be quarantined, because if both people are using the app, you know the distance. If you are not using the app, then you are more likely to get stuck inside of a larger required quarantine due to the fact that we're not able to accurately measure how long and how close you've been to someone who's been impacted. So that is one of the important reasons. I also share a story that I was notified of a local business where an employee had the WeHealth app downloaded and received a notification of an exposure to a positive case. That employee then correctly did not go to work and followed the guidance they received to get tested and quarantined. They notified their employer, who then encouraged other staff to get tested, organized a deep clean, all within a day. This quick action by the employee in the business, which was triggered by the WeHealth app, hopefully stopped a potential outbreak within their workplace. This is exactly what the WeHealth app is for, and why it is vital that employers ensure that their employees are using it to protect their business and also to protect their coworkers in these cases and instances. If you have been advised to quarantine, this means you have potentially been exposed to a positive case. There have been persons who have been asking for clearer guidance on the meaning of quarantine, so I'll briefly like to explain. As stated on the government website, to quarantine means you have potentially been exposed to a positive person. To stop the further spread of the virus, you may be asked by a contact tracer to quarantine at your home for up to 14 days. Therefore, you cannot leave your property. This does not mean that you must only stay in one room on the property, but it does mean that you should follow some important guidelines to quarantine effectively, such as wearing a mask around others who have not been exposed, cleaning and disinfecting any surfaces or objects you touch, and monitoring your health. Further information on this can be found on the government website, coronavirus.gov.bn. The most important tool that we have is our vaccination program, which I'm pleased is continuing to operate well. And it is a vital part of our healthcare system that we are working hard to protect. I'm delighted that, as mentioned by the Minister of Health, we have now administered 38,557 doses as of yesterday. We set a target of administering 38,000 doses by March 31st. And I must congratulate and thank our health teams for working so hard to reach this target. And we set a target and they have done it. This is something with all the bad news to be celebrated. Despite the challenges we have faced, we accomplished what we set out to achieve. This means that 42.5% of our eligible population have achieved at least one dose, and 30% of our eligible population have received 2 doses, which the minister has said equates to about 25% of our total population. These persons are protecting themselves and others and are helping us go slowly towards that magical target of 70% of the population, which is required for herd immunity. We are also seeing an increase in persons under the age of 50 being vaccinated. And I thank those persons for taking this important step for registering and being a part of the total vaccination efforts. Some of you have reached out with concerns about the vaccine's effect on fertility due to misinformation you've seen on the internet. While my first message will always be to speak with your doctor about concerns you may have, I will share 2 important messages on this matter. In a joint statement last month, the Royal College of Midwives and the Royal College of Obstetricians and Gynecologists in the UK said that there is no biologically plausible mechanism by which current vaccines would cause any impact on a woman's fertility. In addition to this, the British Fertility Society and the Association of Reproductive and Clinical Sciences also published guidance saying there was absolutely no evidence and no theoretical reason that any of the vaccines can affect the fertility of women or men. While I hope this information allays some of the concerns being expressed by young women and men in our community regarding the vaccine, I encourage you again to speak with your doctors. Do not be misled by false narratives on social media, and look for research from trusted sources and speak to professionals. Another question that I've received a few times over the last week is, can a person who is vaccinated or immunized still get the coronavirus? The answer, as we've said on a few occasions now and even last week, was yes. A person who is immunized can still test positive for the coronavirus. No vaccine, including the Pfizer-BioNTech vaccine and others created to protect us from the effects of the coronavirus, which is coronavirus disease, can fully prevent an infection from a virus. Their main purpose is to prepare your immune system to fight that particular virus if and when you are exposed to it. The coronavirus vaccines have been shown to be incredibly effective at preventing severe illness, and with the vaccine that we're using, to be one of the most effective against COVID-19. In addition to preventing severe illness and symptoms, and this is one of the most important reasons why, vaccines also reduce the possibility of transmitting the virus to others. The more people that are vaccinated, the less the virus affects each individual, and the reduction in the transmission ultimately leads to the virus hitting a dead end with nowhere to go. And that is what we are trying to achieve with all the mitigations, the public health measures, and our vaccination program. On Sunday, Dr. Krika Weldon joined me for a Facebook Live conversation where she explained this in a way I think we can all understand. In a recent batch of approximately 400 positive cases, roughly 10% of those persons were fully immunized. Those immunized persons showed significantly less amounts of virus in their system. Less virus means less ability to transmit, and almost no ability to transmit if you're following the precautions. And that means that those persons are unable to or less likely to cause a wider spread versus those persons who would not have been vaccinated. Along with this internal protection for our immune system, we must also combine this, vaccinations, with external protections such as wearing our masks, physical distancing, washing and sanitizing our hands. This again not only protects us, but protects others who have not been vaccinated yet or who cannot be vaccinated for healthcare reasons. Again, we are in phase 3 of our vaccination program, and I encourage all persons over the age of 16 to register for the vaccine. We all look forward to a time of no restrictions, to gathering again without fear, and to enjoying our daily lives without the cloud of the pandemic hanging over us. Despite the period of which we are in right now, with an outbreak with a number of cases, I still am confident that in 2021, we will get back to a place of normality. We will get there by obeying the regulations, downloading the WeHealth app, and registering to be vaccinated. The only way to bring about the changes we need in our circumstances is through continued unity and the recognition of a common goal. At present, that goal is to contain this outbreak and reduce transmission. We've done it before, as was shown in the last outbreak, and I have no doubt that we will do it again. It has not escaped me or any member of the cabinet that we have had to implement these new restrictions with one of our island's most important time of the year approaching, the Easter holiday weekend. While I wholeheartedly wish this was not necessary, in leadership often we have the responsibility to make the tough decisions even when they are unpopular. In a crisis, you also do not have the luxury of time to often second guess crucial decisions. I am saddened that in many instances, we will not be able to meet up with our families and friends like we normally would. And that is unfortunate. But above all else, I want us all to be safe and healthy to celebrate in the days ahead of us. We have sacrificed so much over the last years, and all of those sacrifices will not be in vain. I thank each and every Bermudian who has worked with us, sent messages of support and encouragement, and most importantly, taken personal responsibility every day to do what is right to help to protect themselves and their loved ones. I also thank the Bermudians who have constructively challenged us and asked the tough questions. No one in leadership is perfect, but what I can assure you is that we will continue to work hard to see Bermuda through this. But please remember, the government cannot do it alone. It requires all of us to be united in this mission. As I close, I know that many of our community may need extra emotional support. Please, if you need someone to talk with, call the Emotional Wellbeing Hotline. That phone number is 543-1111. and the line is operated Monday to Saturday from 5 p.m. to 9 p.m. Again, that number is 543-1111. Please call as help is available. As always, please now send a message "Hi" and you will receive updates directly from the government of Bermuda to your phone. At this time, I'm happy to take questions from members of the media on behalf of the people of Bermuda.
Good evening, Premier. Good evening, Minister. We'll start with the Royal Gazette. Royal Gazette, you're live. Royal Gazette, you may ask your first question.
I hear nothing.
Okay, I think he may be having problems. We'll come back to the Royal Gazette. Please stand by. We'll now go to, oh, there we go. Gareth, you're live. Please go ahead. Okay, I think there's a problem with his volume. Gareth, we'll come back to you. We'll now go to TNN. Okay. There's no TNN there. We'll go to Media Maya. Media Maya is coming online, Premier.
Okay, can you guys hear me?
Yes, we can hear you. Go ahead, Media Maya. Media Maya is coming online, Premier.
Hi everyone, good evening. My applause.
Hey, can you guys hear me?
Yes. Go ahead, Media Maya. Media Maya is coming online, Premier.
Okay, so my first question, sorry if the audio is all over the place. Are cloth like cotton wraps and bandanas considered as full protection masks?
Thank you for that question. When we first started the requirements to wear masks, at that time there was a short supply of the surgical masks or the blue masks that you would see that people were wearing. So there was encouragement for persons to make cloth masks, which are just recyclable and the like. I can say that the requirement to wear masks is what's mostly critical, and how you wear it is what's mostly critical. So if it's a cloth mask as opposed to one of the surgical masks, they're both designed in such a way to help provide you optimum protection. Given certain circumstances, you'll see some people have on the N95s. Those are meant to be reserved for persons that are within the medical community. However, as long as you're wearing it properly so that you're covering your nose and your mouth, not wearing it on your chin, because your chin doesn't need any protection, but covering it and wearing it properly, then a cloth mask can provide sufficient protection for an individual.
Thank you very much for that. My next question actually comes from a community member, and I'll just quote it all. In regards to the group gatherings and restrictions currently set at 10 people, can you please advise if there's any way government can start to look at not counting fully immunized people in that count? For example, this person, I have an immediate family with about 13 people, of which 6 have been fully immunized against COVID, 3 children under the age of 13 who can't be vaccinated, and we are still cannot gather together. It seems that the restrictions should be less or strict for fully immunized people. So the question is, could there be a difference for fully immunized people for those group gatherings?
Thank you, Maya. That question comes up quite a lot, and I'm going to yield to the CMO, who's actually on the call as well, who can explain the science and the research behind what they're trying to ascertain concerning the evidence with respect to transmissibility for persons that are vaccinated. But he's online, so he'll speak to that. But we are looking at certain inducements, so to speak, for persons that, or relaxations for persons that are vaccinated. However, again, the challenge that still exists is the lack of evidence supporting the fact that persons that are immunized can still transmit. CMO, can I ask you to provide further details from a scientific?
Certainly, Minister. Hello.
So for people who have been immunized, remember, as the Premier mentioned earlier on, the studies that have been done shows that this vaccine protects you from serious illness and from need hospitalizations. And for most vaccination programs, they don't entirely prevent you from getting infected. So why we include immunized people in the mix for this size consideration is because they are also vulnerable. They can also get the infection. The difference is that they are unlikely to get serious illness and end up needing hospital care. But crucially, as the minister said, the jury is still out on whether they can pass it on to somebody else. So the reason why we're including vaccinated people in that mix is not particularly for their protection, it's for the protection of others, the more vulnerable in the society. When we get to this situation where most of our island is covered, and certainly the most vulnerable on our island is covered, then we know that there isn't a risk that we can pass on the infection to someone who may die from it. And we can then start reducing the and relaxing the restrictions that were put in place for immunized people.
Okay, all right. Thank you very much. My third question is, someone have reached out to me to let me know that even though some persons are not hospitalized, they are at home and nurses are being sent to them with oxygen tanks. So my question for people who are not hospitalized, but are actively, but have COVID, or are active with COVID-19, are they being catered at home with nurses and oxygen tanks considered to be persons who are under active hospitalized? Is that clear? Let me ask that question. I'm sorry. I was actually more focused and now I'm not reading it as it was written. So let me just.
I think I know what she, am I muted? Can't hear you.
No, you're fine, Minister. Go on.
Oh, I'm sorry. I think I know what she's asking. When we, Maya, when we produce the statistics concerning hospitalized persons, that includes only persons that are treated for COVID whilst in hospital, resident in hospital. If persons have COVID within the community, they're part of our overall stats, but they're not part of the stats with respect to hospitalized patients.
Okay, so persons who are at home and might be visited by nurses or with oxygen tanks are not included in that number.
The number is just the person's resident in hospital.
Okay, thank you very much.
You're welcome.
And fourth is, what measures are being put in place to keep up with this new, well, the third wave, really, when it comes to now hearing that, the Bermuda Hospital Board said that, the X-ray services will be ceased for 2 weeks and, outpatient clinics will convert to telecommunications. Like, how swamped is our health services? I know everyone's working double time and overtime to do things done. So my question, my real question is, are there applications available for family doctors or private doctors, or even communications people to help to assist the Department of Health in Bermuda? Already help.
I'm not sure I get the question. Could you say that again, please?
Are there more people out there in Bermuda who can assist and help that could be called on that we're not currently calling on right now with this huge swamp that we have?
Minister, I can have a go at this?
Yes, sure. I'm sorry, I heard you. Thank you, Maya. The question is, are there others that we can be calling on, like doctors and other members of the community, to help? We have raised that flag repeatedly over the last year, particularly in recent times with respect to vaccinators. We have over 100 persons from the medical fields, veterinarians, dentists, physicians, et cetera, that are assisted and helping us to defeat COVID and to provide vaccination services. You heard me announce just a few moments ago, I'm so thrilled that Edgewood Pediatrics have come under Dr. Sylvanus Nawab and his team have come to voluntarily offer their services to persons who book appointments this week to be able to get COVID testing. Because as you can appreciate, we are trying to encourage people to know their status, and they're doing it free of charge. And there's other doctors' offices that are also agreeing to sign up for that and to provide this community outreach, again, free of charge. So we have been reaching out to the doctors as well as other members of the medical community. The CMO is particularly the medical, what's it called? MDA. Is that right? The MDA? That you're the chair? Yes, okay. So through the Medical Doctors Association, through his involvement with that as the CMO, he's constantly requiring and requesting for them to assist. And by and large, we have had tremendous support from the medical community to assist with in our battle against COVID.
Very much. Those are my questions.
Thank you very much, Media Maya. We'll now go to Earl Basden from Island Stats. We'll give him a few seconds to actually come online here. Earl Basden, you are now live at the press conference. Please go ahead with your question.
Good afternoon, Premier. Can I ask, how many people are coming to Bermuda to facilitate the COGP, and how are we protecting ourselves from these people who are entering the island in a short space of time?
The first question is, I do not know how many are entering, but we can look to get that information for you. The second thing is in regards to how can we protect ourselves from these individuals?
Yes. They're coming from places where they're coming from.
Hold a second, I will answer the question.
Okay.
Earl, give me a minute to answer. Thank you. The question is, how are we protecting ourselves from these individuals? They're protected in the way which travel to Bermuda works, with pre-testing, testing on arrival, and depending on where they're arriving from, a period of quarantine. I think what's most important to recognize is, however, that of course, as this is a sailing event, which people may compete for prizes and actually have things in the interest of the organizers to ensure that no one actually either gets infected, breaks the bubble, or mixes with other people. So they're going to be in a bubble the entire time. I can actually send over the full safety protocols for our island stats. I think that'll be helpful, so you can share that. I did get that from the Bermuda Tourism Authority yesterday, and that information, but they are tested, I think they're almost tested daily to make sure there's no spread amongst their bubbles. But in the individual teams remain in their bubbles, leave the hotel. They don't even eat with the rest of the people in the hotel. They're separated. So there's an entire bubble for the entire process. If people go back to the NBA bubbles and other types of sporting bubbles, it's similar and akin to that.
Okay. And who will have to pay if they have to stay later than if someone tests positive out of the group? Who has to pay? Is that on us, or is that on the event organizer? Who's responsible for that?
Oh, that would certainly be on them. That certainly wouldn't be on us, as it is now.
Okay. All right. That's it for me.
Thank you.
Thank you, Earl Basden. We'll now go to Don Burgess from Bermuda Broadcasting. Don Burgess? He's still connecting. Don Burgess, you are now live. Please go ahead with your questions.
Thank you. Mr. Premier, Dr. Weldon, the CMO, and you yourself have all spoken about the new B117 variants extended incubation period. We are seeing evidence of this in scientific research and locally in Bermuda with more positives coming on day 14 tests. And we also know that some people exit quarantine and then test positive. Hong Kong has implemented a 21-day quarantine for this reason. Based on science, will you be extending the quarantine period? And if not, why not?
Hello?
I'm here. There's a question wants to take it. I'm happy to take a stab at it, unless CMO or Minister.
Oh, no, I think the CMO was, I think we were thinking about that. Don't, he said, ask the question to the Premier, but CMO, right. Yeah. No, CMO, okay. You can answer, the Premier will yield.
Okay, thank you. Right, so yes, you are right that we are learning more and more about this new variant, and I'm impressed, Don, that you got it right, B117. So thank you. Yeah, we're learning more and more about this, and what it appears from the literature is that the incubation period it's a lot more variable than what we expect from the wild type virus. But before we make such changes around what we think is going to be natural history of this infection, we need a lot more information. At the moment, you are right, we will testing at day 14 allows us to be able to capture most of these people. And if we need to then extend it afterwards, then that's what we're doing at the moment. So the short answer to your question is we still need more information before we can change policy on the length of incubation.
Okay. Along with that, the new B117 variant is, as you just said, more transmissible than the wild type strain. The risk of exposure is no longer 15 minutes, but perhaps as short as 30 seconds in close proximity. Based on the new scientific research, will we be instructing the WeHealth app developers to adjust their algorithm to take into account the shorter exposure risk?
Okay, I'll leave that you to the Premier.
If there is a need to do so, those things can be done, and we are guided. I know that with the implementation of this, this was done with the team. WeHealth is not just in Bermuda; it's in many different places. And if there's a need to update the algorithm, we can certainly do so.
Okay, thank you. In Bermuda, we don't currently have early stage monoclonal antibodies, which sharply cut the risk of hospitalization and death, but they need to be given within the first 7 to 10 days of infection. Why are we not using monoclonal antibodies as a first line of treatment when people first receive a positive test? And who would administer this infusion treatment? GPs, the Ministry of Health, BHP?
I think this is for me, Premier. So, right, yes, the monoclonal antibodies are very expensive and they're very difficult to come by. So it's not as easy as some of the other medications that are much more easy to procure. In discussions with the hospital staff, and in particular Dr. Ashton, who's the infectious disease doctor, shows that the hospital has convalescent plasma, which is basically a less refined monoclonal antibody. It's basically people who have had COVID in the past, have mounted antibody response to it in their system. The blood is extracted, and a particular part of the blood that is rich in the antibodies is extracted and infused into patients who are early on in their disease to prevent prolonged infection or prolonged hospital stay. But that has to be done in a hospital setting. It can't be done in the community.
I thought the latest research about the convalescent plasma showed that it had no significant decrease in keeping people healthy.
It's I need to check the research again, but if I remember correctly, it does reduce length of stay in the hospital, but not necessarily does have an effect on deaths, but reduces length of stay in the hospital. But I need to check the paper again.
Okay, thank you. Health Minister, yesterday there was high demand for the no appointment pop-up COVID testing at TCD, and you have already listed where the new next pop-up testing is going to be at TCD in Horseshoe Bay. Given demand, will we be adding more pop-up testing, and can the car park at Horseshoe Bay handle similar demand?
For starters, the Horseshoe Bay one is a walk-in, so we wouldn't anticipate seeing the extent of traffic that we would have seen yesterday because that was a drive-through. Secondly, as we've indicated, we are doing the best that we can by utilizing all of our resources to increase our testing capacity. Having doctors come online and offer their surgeries to do so is one step in the right direction. You can appreciate those persons that are doing the testing have been doing so for over a year. Unfortunately, some of those too have been placed in quarantine. So we are having the effect of the quarantine and the transmission of the B117, or as most people know it as the UK variant, is affecting Bermuda, and regrettably, it's affecting some of our healthcare workers as well. So we will continue to utilize the resources that we have and offer and increase the pop-up testing as we can. And we also have been adding additional hours to the stationary testing sites at Pennis Wharf, Bull's Head, as well as the PROTS post office. So we are trying to, given the resources that we have and the restraints, we are trying certainly to increase the availability of COVID testing. It's we're encouraged by the fact that people want to know their status. So that's the good news. It's a little bit unfortunate that it takes an outbreak for people to go and run to get their status, because 2 months ago, there were 1 million appointments available, but at least people are taking advantage of it, and it's a good thing. So we're going to continue to do our best to facilitate offering more testing for persons that want to know their status.
Okay, thank you. Bermuda Broadcasting has been informed today that it's currently not possible to make an unemployment benefit application via the government's website. Something is not working with the online application. Mr. Premier, can you comment on that?
I'm going to try and fill it out right now, but I haven't. That's the first time I've heard the complaints. I know there were some issues accessing the site, and we had the teams check on it, uba.gov.bm, but I will find out if that's the case. But I have not heard that at all. I know that some issues were with access to the site, and a few other members of the media reported that, and we had our IT team check into it.
Okay, thank you very much this evening.
Thank you very much, Don Burgess. Premier, Minister, we have questions from the World Gazette. As you'll recall, they weren't able to have the questions, so they've submitted them to me. And so, Minister, we'll start with you, and this is from the World Gazette. Last night, Minister Wilson said she wanted to increase resources for the helpline, testing, contact tracing. Have you been able to do this, Minister?
We are still looking to employ, increasing our resources. As I've indicated, there have been more doctors' offices that have agreed to come on board to provide testing, COVID testing within their facilities, within their surgeries, excuse me. One of the challenges that we have had is with respect to our telephone systems. However, we are working with ITO to get a solution to that will allow us to have more trunk lines, more telephone lines, so that we can get more persons answering the inquiries. Yesterday, we had probably over 1,300 inquiries between 9 and 12 o'clock. So that's so there's a technological solution to that. So I've been made to understand from the Premier that that's going to be actually facilitated this weekend. So we will be able to have more phone lines with certain members of the public, particularly in the public service, that are actually working from home because of quarantine. We'll be able to facilitate the use of some of those individuals to help with our phone lines. So we are moving in the right direction.
Thank you, Minister. Another question, why the low numbers of hospitalized cases? Any reason for this? Maybe that's for the CMO.
Thank you. I don't want to tempt fate, so I'm touching wood and everything, crossing everything. Well, we don't know. That there could be several reasons for this. First of all, this particular outbreak is only been on for a few weeks, and what we know from the natural history of this infection is that from the start of your outbreak, you start to see hospitalizations 2 to 3 weeks after the outbreak starts, and then 2 to 3 weeks after that, you begin to see deaths, unfortunately. That's what we expect, and as the Premier mentioned, there are people who are on admission in hospital now. We're hoping that the mitigation that we have is the number of people who have been vaccinated. So we're hoping that the number of cases that will end up in hospital will be minimal, and hopefully we can avoid deaths this time around. But that is based on people being fully vaccinated. There is still a significant proportion of our vulnerable population on island who are not yet vaccinated. And this is your best chance of preventing serious disease. Get vaccinated. We're in phase 3 now. The vaccine is available for everybody who wants one. Register and get vaccinated.
Thank you, CMO.
I think also it's important to add, Anuranka, and I think it goes back to the question last week where they were, why is the government implementing restrictions that when there's, no one in hospital? That was last week. Now there's 3 people that are admitted. The fact is also, it's important to note that if we follow the updates from the Ministry of Health, last week with our active cases, we're at a median case number age at 30, and now we're approaching 40. So the cases are getting older, and it is reaching more of the older population. And so from that case and instance, those are the people who are most vulnerable. Also, when we're talking about on Sunday night, I stated the issue of children or next of kin of persons who are in long-term care facilities who are not consenting for them to be vaccinated. And it is quite upsetting that you could think of people who are the most vulnerable persons in some of the most vulnerable settings of where around the world we have seen significant loss of life inside of long-term care facilities. We have not missed or eliminated that here. We have the ability where we put those persons first, and we still have a significant number of them that have not been vaccinated. And so the call of which the CMO and the minister has made again, the call of which we made on Sunday night, if you have a loved one in a long-term care facility, whether or not they be your mother or father, your aunt or uncle, or someone that you care about, check with the family and ask the question, because you will assume that everyone in long-term care facilities has been vaccinated. And the fact is that is not the case. And there are, with the scale of this outbreak, with the transmissibility of the outbreak, with the challenge with which we're having, I fear for outbreaks inside of long-term care facilities and the challenges of which will arise if persons who contract the virus inside of long-term care facilities are not vaccinated. So it's important that you follow that train, and clearly, as the CMO has indicated, you have the outbreak, and then the surge in cases, and then a few weeks later, you have increased hospitalizations. It is a hope that we don't get there, but we never know.
Thank you, Premier. The next question from the World Gazette. How many of the positive cases that have been vaccinated had 2 vaccine shots? So how many of the positive cases that have been vaccinated had 2 vaccine shots?
So we're still working through the cases, and as you can imagine, the numbers keep changing. But as it's been mentioned earlier on, approximately 10% of our active cases have had full vaccination. But it's important to state that what we're finding predominantly in that population is that they have the level of values of their test does not show that they have a lot of virus in their system. What that means for transmission is still not very clear, but what we know from empirical evidence is that the more ill you are, the more virus in your system, the more transmissible you are. So it works out that if you are vaccinated, you have mild symptoms, and you have very low virus in your system, the chances that you'll be able to transmit it is lower.
Excellent. Thank you, CMO. Premier, another question from the World Gazette. The Premier has said that mandatory quarantine requirements will be introduced soon for non-vaccinated residents. What will these be, and when will they be coming into effect?
There'll be things that are under consideration. There's conversations, discussions that are taking place. And when we're ready to announce them, we will. But I think from a balance of what we're speaking about is right now we have this variant. We know that with the pace of RNA viruses, there'll be other variants because they mutate very quickly. And then we need to be on the lookout for that. So of course, the system of which we have in Bermuda is we balance all sectors of our economy. When there are vaccinations that are readily available inside of all of our gateway cities will be the time when those things will begin to be introduced. But I think that you can expect an announcement on that as we want to give our tourism partners enough lead time. I think you can expect an announcement on that in the near future. So from that perspective, I think it's important. And the construct of that will be similar to the construct of the United Kingdom, that it will be on the traveler's expense. So if you come back to Bermuda and you are unvaccinated, and you will be in a facility, and as long as it needs to be, it'll be at your own expense. You will not be at the expense of the government of Bermuda. So of course, we will continue to move, continue to evolve. And now that we have vaccinations and now that we have the ability to make sure that we can reduce the risk of these things, now we need to get to the place where these things come into place. So people who do not wish to be vaccinated or travelers who are coming into the country will be subjected to that. And we don't know the time of when that will happen yet, but we will certainly, the timing will coincide with the wide availability of vaccines in our major gateway markets.
Thank you, Premier. And the final question from the World Gazette, Premier, for you again. Cruise ship home porting in Bermuda this summer. Is the Premier confident Bermuda can handle logistics, lots of passengers, and closed in one space? What COVID protocols will be put in place?
Well, the most important COVID protocol that's going to be put in place for those persons is that no one is going to be able to get on a cruise ship from Bermuda if they are not vaccinated. And so that is the number one matter that will happen. And of course, the person still will require to pre-test and test on arrival. So we're talking about pre-test, test on arrival, and a combination of vaccinations is certainly going to be a significant reduction in that risk. And so the precautions will be followed, but I have every confidence that the teams in the Ministry of Transport will be able to make this a success. And I have no doubt that the country will join with them in making this a success as well. But that's the key mitigant there, that what we had said when we discussed importing with cruise ships, there was one rule and one rule only, or one requirement, is that everyone on that boat will need to be vaccinated, and the cruise ships have put that out inside of their items. Some people have pushed back on that strongly, but I think that if you're going to go on a cruise, you want to have a view and an idea that you may be safe. So the testing combined with 100% vaccination inside of those environments should make it safe.
Excellent. Well, thank you very much, Premier. There are no further questions from the media.
All right, well, thank you. Thank you, CMO, and thank you, Minister of Health, for your continued work, energy, and efforts. I know that there are very long days. I want to continue to encourage the people of Bermuda to please follow the public health advice. Please do not mix your households. Please remain and stay inside of your bubbles, and make sure that if you have symptoms, go ahead, call the helpline and get yourself tested. We will get through this. We will be okay. But it's important. The only way that it will happen is if we all follow the public health advice which has been issued. So with that, I want to say thank you. Oh, I got that wrong. Thank you. Thank you, Bermuda, and good